Hello, hi,
Hello. Hi. Hi, thanks for joining. Thanks for
most
accepting
welcome.
the invite. Also for the viewers joining, hi, I'm Shivani again with another live, and today we have joining us. Our care talk is Dr. Nikunj. He's a psychiatrist practicing in Mumbai, and he's going to be here talking with us about relationships and mental health, romantic relationships more specifically. So, why this topic? If our viewers are even thinking, I think that's just so pertinent to, I think, this age. Like, we have relationships all around us. Romantic relationships can, form such an important part in our lives, and in our premarital life, our marital life, or like, just that stage between there, when you're choosing your partner, it can all become so important. Why? And is there any connection of mental health as such? I think there's just so many questions that we may think, people who all like maybe suffer with mental health issues, or those who don't even like may wonder what happens, to a person who would want to have like a long-term partner or something like that. So I think the first and most important question, then kind of hits us in the face is, are the two related? Are romantic relationships and mental health, are they related in any way?
Yeah, hi Shivani, and thank you for inviting me over here to the platform. And hello all the viewers. So, coming to your question, yes, the romantic relationships and mental health are very much related. In fact, mental health is something which plays a role in each and every aspect of our life, to be honest. And if I have to talk to in specific with the romantic relationships, there is always a bi-directional relationship between the romantic relationships and mental health present always over there. Yeah, so it's like if there is any changes in your mental health, there will be some impact seen on your relationships and your living, and also the vice versa is always seen present.
All right. So basically, what you mean by bidirectional is like it can impact, like the mental health can impact the relationship, and the relationship
Yes,
can impact the mental health. So I mean, how important is it then, to think about this before maybe getting into a relationship? Is there any importance of like, asking oneself this question? Because you said it's basically got a correlation, right? So like how are we to judge?
absolutely. See, mental health today. I'm very happy that in our generation, people are having a bit of more awareness compared to our senior generations, and people do consider it important today and are looking towards into it. Even if they have a smallest issues, they will try to come and speak to the professionals and gain information about that. So that is very important. Similarly, during your romantic relationship, as you asked, it is extremely important to know your own mental health first, and then also about your partner. So, what I mean to say in this is that always if you're going for any romantic relationship, like as in you were planning to date someone, or you're just going to planning for any marriage proposals in the arranged marriage, or you're even in the if you've been in a relationship for a very long period and you're planning for a long-term commitment like a marriage, then always go through the history of mental illness, any histories of any mental illness in your partner, or also is there anything significant in their family, because many of these things could be genetic, which can also impose an impact in the future also. And at the same time, they are important for you and as a person to survive and enjoy the relationship, to be honest with. So, like the very simple factors which in this which you should look into is so it should never take a judgment on the basis of the one or two meetings or just exchanging text for a one or two couple of days. Just know the person. It's always as it is always said. Okay, make friends first and then know your partner well and then take a step towards any romantic relationship, as it's going to be something about commitment for a prolonged period which you're looking forward to. So in that area, always understand what are the how the player, how does your partner behave under the stressful situations? How does he or she behave under the joyful situations? Under there is some when something saddening which is happening in there, how are they coping with such scenarios? Or various places where you should always assess them and always go ahead into the situation further.
Okay, so what you're saying is it's important to have a talk about just the mental health aspect in any given relationship, right?
Absolutely.
Before taking that big leap of, trusting someone with, their, future, obviously, which is such an important part anyway. Even without the mental health, there's just so many things to talk about. So how does a partner even begin to, speak about it? Because obviously in India, we know, we work in this industry. We know how hard it can be to speak about, things like this. So how do you suggest a partner who, let's say, is facing issues, of mental health, any condition, like maybe just an episode, or like let's say it's a long term one. How does one tackle, this conversation with their partner who may not be in their shoes at that moment?
Absolutely. Okay, I will let us take some small examples so it will be more easier for me to explain to the viewers also regarding it. So, as you said, there's some one partner who is suffering from a mental illness in a long period, a prolonged period. Let us take that example of mental illness to be something related to anxiety, which is very common these days for everybody. And let's not label it as any disorder or illness, something which is a part of his personality itself. Like before exams, people have butterflies, they have difficulties in focusing, they sweat, cold palms, and everything goes on. Same thing before speaking in front, public speaking or going in front of stage, something that a partner has it. And when they are entering into a romantic relationship or they are going ahead with somebody else and they're planning to go about it, so always see whenever you are into this having these issues or these problems with yourself. So in the scenarios where you have to face this, always in beforehand have a communication with the person. So what do I mean by that? If XYZ person is facing these issues and another person is going to planning to take you for a clubbing for the first time. They ask you to let's go clubbing tonight, as it's a Saturday night, for example. And something is social anxieties, which is very much there present in that person, that it makes it uncomfortable, him or her, in such scenarios. So just tell him that be very vocal and clear about it. See that I really enjoy clubbing. I have been through there multiple times, but when I am not going for the first time or when it is in a very completely unknown place, it makes me a bit anxious. So that the words used like anxious and depressed are very common. So along with that, but just try to explain what do you feel. So because when you label yourself as I have an OCD, I am a psychosis, or he has a crackpot. Instead, just explain what do you feel. Just to go and tell him that I feel cold feet. I have an issue when I have to communicate with the person who's in senior to me, or in the party when I have to go. If you will introduce to me a bunch of your new friends, it is going to be a little difficult for me for initial time. So try to take care with me at that time. So, try to break down that thought process or do the word or wholesome. What do you experience? So that it is easier for the opposite person. Because if opposite person has some mental illness or has read about it or is aware, it would be very easy and will make you comfortable very much. But if someone who has never faced that in their life would find it very difficult and little astonishing. And also, as there's a great taboo, as you mentioned, okay, this person has a mental illness kind of a thing, that will become a problem for him or her. So that is when you break it down for them, so that way they might understand that even they might have gone through that or they might have seen, because this is very common in every person's like, I can say that every 1 in 10 person will suffer from some or the other mental illness, and you might have seen in somewhere or the other place. So always try to break it down and have an open communication with your partner regarding same.
Thanks for that insight. I think that's quite useful in terms of like every day, like, anyone going through any sort of thing, diagnosed or not diagnosed, we know what we feel at, any given moment. Sometimes we don't, but usually, like, I think knowing that and then explaining that to the other person, being communicative about it, helps a lot, to tackle, I think, this challenge that is communication. So I think being on the side of where you are facing these issues, I think you covered that, like, I think pretty well. But what about the other person who may not have had any, anxiety issues or any, depression or anything related to their mental health, and they've been fairly resilient and they've never had to deal with anything like this? How do they approach their partner who, may not have had any, anxiety issues or any depression or anything like that, and they've been fairly resilient and they've never had to deal with anything like this? How do they approach their partner who they may have noticed, or they may have told, their partner may have told them, that this is something I go through. How does one approach that? How does one respond to that? What are the things that you should say? What are the things you should not say? Because sometimes that also becomes a big challenge, saying something wrong to the person who's going through that, they may get defensive. So just a few
Absolutely.
tips if
Absolutely. It's a very important thing what you mentioned and you asked actually. It's a very good question, in fact, because there are many people who might have faced some things or might have seen but do not want to acknowledge it. And once their partner say it to them, it's like just bang on their face and it becomes difficult for them to react, to be honest. So the most healthiest way, very first step, which I would request everybody to go through is to be patient at that time and do not give any reaction at that time. Take your own time to process that thought. All you can, the very first statement you should be over there is, okay, I am listening to you. Give me some time to process it. Even if you are aware about the scenarios and even situations, but always ask for time so that you know the what is the right reaction. And in the meantime, the opposite person who has expressed a very big part of themselves and they've come front in front of you and very completely naked about it will understand that the opposite person is giving me an honest chance to go through that. That is like the very first thing which should always be made. Ask for time. Do not rush into anything immediately of making conclusions or jumping to things. Okay, I'll take you the therapist. I'll get you the medicines. Or like, okay, you are a crack. Anything like anything related to mental illness, you are a psycho. You do not, I cannot deal with you. That is something which is very loud reaction seen. So my very first thing which I would like to tell you is that have patience and take time for anything and everything what you want to understand. The second most important point in that is that once your partner has expressed something to you, think through that and use Google or the social media today rightly. As everybody is mastering Googling things, but there is a bunch of information which can take you to the South Pole and the North Pole, depending how you take it totally. So always look for some authenticities in the or the content you're looking for. And today, social media and our generation, the Gen Z generation, social media is coming up, digital media is coming up to another level where people are supporting and are willing and explaining things out. So gain your knowledge, reach out to the people to get the right information about it, and then go and have a communication about it. Again, in these the partners also who has received the information, the mainstay would be communication. What I say, and I believe in any relationship or anything, communication is mainstay. If you maintain and have a healthy communication, just weigh and time your communication. That is also important. As I said in the first part, do not immediately give your reactions. Take some time and ask your doubts. The more you ask the opposite person, they will be comfortable. They'll feel more comfortable. Okay, the person is making an effort to understand instead of just making a judgment directly. So that is those two are major simple tips which I feel then that could help them a lot to go through this process.
Yes, they do sound very helpful. I think these, things that we should just keep in mind when speaking with someone who may suffer from any of these issues. Because I think we talk a lot about, how to deal with your own mental health, but not a lot of people talk about how to just talk to someone who's dealing with those things. Maybe
Exactly.
they'll be okay with it by themselves, but when sometimes people judge you for sharing that, it becomes a bit harder to even go. And especially when it's a partner, somebody so intimate to you, it becomes even more difficult. I think so. From this point, I would like to ask, I mean, what happens if we don't have the ideal partner? What happens if our partner is not very accepting of our mental illness? So can that make things worse for a person who's, suffering from something like depression, or even like, anxiety issues on just like a random day? Like, what do you think? Is that possible?
Absolutely. So as we started our conversation and as I mentioned that the mental health and the romantic relationships is a bi-directional thing. So definitely they create a very important impact. And the most commonly these people are aware about it, like they term it as we term it, in fact, not people, we term it as toxic relationships. when it's like the toxicity is very high. It is just not there something which I can bear. That is like in something which commonly people are trying to communicate about. So what is the toxicity in it is which all you need to understand. So for example, as you said, if somebody is suffering from depression or having some anxiety issues or even from something from the psychotic syndromes, if they are going through, or a OCD, something what they are suffering from, the opposite person will always have difficulties initially probably to accept it. And if that is not being accepted, it will create an impact on the person suffering all the more, lot more. Because, for example, if I'm suffering from depression and my part, and because of which my activities are going on the low scale, I am not in the good mood most of the times. Either I'm because when we see depression, people immediately think I'll be crying in the corner of the room and just being sad. That is not true. A person can be just irritable repeatedly or agitated without any reason. They would snap at you, which is not their personality usually. Because being a romantic partner, you might be aware about how they were and you see a transition in that. So when the person does not accept this, even after explaining them, these things can worsen, which will affect not only at your mental in the mental health, but it will also create an impact on your personal life with other relations also. Also, it will create a major issue towards your workplace or your if you're studying, because already the illness causes difficulty and has some cognitive deficits. It's leading to difficulty in focusing sometimes to people, be it any disorder, or it will also impact on your sleep. And when these things are not accepted by the romantic partner you are in with, which whom you expect that there's a basic understanding is not there, things will just go down the hill more for them. And then at such basis, the person should always and always understand to prioritize themselves. Remember, that is the golden rule. If you are fine, then only you can help others and or you can enjoy the life with others. I always tell my clients this, like you all have visited in the air flights, and always there's an instruction. पहले खुद का mask लगाओ, then बाजू वाले का लगाओ. It's something very much you should always remember in your life. That if you are fine and if you are focusing on yourself first, then you will be able to live in a relationship and have a happy life. So keep a stand for yourself if the opposite person is not able to understand you very well.
Yeah, I think that is so important. And thanks for, highlighting this when it comes to like romantic relationships and mental health. Because I think there's a very big myth that only if you're in a relationship will you be happy. Especially, obviously, there's, cultural things that are at play, but, the society in general, like, will not let you be happy if you're not in a relationship or married. But I think it's definitely worth, reiterating that, you really come first. I mean, your family, your relatives, they're going to understand. But if you have not found a partner who's, ideal, or let's not even say ideal, but just understanding, supportive, especially when it comes to mental health, then I don't think there's going, anywhere from that, I think,
Absolutely.
so coming to that, I think then being single, I mean, should people who are single and, dealing with their mental health, trying to navigate how to even, trying to understand themselves and their illness, like, should they think that is it good to for them to, be by themselves, or is it okay to try and, be with someone and be open about it, like, like a partner, or try and find a relationship for themselves? Is that something that's healthy or not?
Okay. So that is another thing which runs a lot in today's world, that if I am single, then something is majorly wrong with me. That is a very big notion which runs around, and very few people are ready to live with themselves, to be honest, which is not fair, to be honest. You were born alone. You are as an individual person, which should always be respected and enjoyed first. So definitely, if you are single and if you are fine with that, and you're figuring out your mental health, give that as a priority. But at the same time, if there is a dire urge in you that I need to have a partner, that is only going to solve my problem. Be open to it, as you mentioned, but do not just jump into any person you find on the street right now. It's like somebody who spoke a little sweet to you, or some people who are just like, no, no, I understand that part, and just then like, okay, they'll start dating. And then there's a whole another toxicity, or there's a whole another stressful thing you're observing. Your mental health was decent, like you had minor issues, But then with such a relationship, you'll get a whole storm coming to your towards you, and it's just like going downhill from there. There's no way coming back to it. So definitely, you should be open to being in the relationship. That is not nothing wrong in that, but always weigh the situation because everything has its own pros and cons. So as I said in the initial thing, communicate, know that partner, understand that partner well, take your own good time. See, there are some people who will understand the relationship, who are clear in their head what kind of partner they want, and in a like speaking for 2 days was also enough for them to getting themselves know, or like knowing themselves and committing to them. But to them also, I would make a request. Even if your gut says that yes, that person is right, take your time, explore that person in every situation. There's no golden word like that. It can be for 5 days, 5 months, or something. There's no golden rule of timeless. It is something which you will understand as a comfort and a ease, where you are able to discuss things and communicate with your partner easily. So it is better for you. So same way. So that is what is important always.
Yeah, definitely. I think it's easier said than done though. I mean, because we keep telling even our friends, ourselves sometimes that no, take your time. But if someone's going through that rough patch, like that depressive episode, like even that short-term gratification by that wrong person may just kind of get you carried away, and it can be so hard to like put a stop to that, right? Because you're like here feeling sad, and then you meet this person who may not be entirely right for you, but then because of that short term gratification you kind of just like go full force, and then then they start to like show you that, oh, you know what, why are you like always so dramatic, or like why are you always so sad, like and then it starts coming up, and then you're like, oh, wait a minute, like where's my gratification?
Exactly,
So, I
exactly.
mean, yeah, I
And
think so. We all need to just be a bit headstrong about it. I think sometimes
yeah, I would just
there's
like to
always this.
add something to this. So, as you just mentioned that after time that the people start changing and they start saying you were not sad always, what you said, it's very rightly said, and that is one of the point where you need to mark in your head and remember that as a pointer. When people say you are not the same what you were earlier, that is the point where you need to think about your relationships and realize whether my mental health is not fine or his is not fine or there's some what is the issue. That's like a bell what you have to ring in your head. Okay, this is the time I need to assess my relationship. So always remember that instead of getting carried forward or justifying yourself, just try to sit with yourself always and think about it. Okay, this is a point if somebody is noticing out. So there's only possibilities like one either of the person can change. Then only you can feel the difference. Otherwise, there'll be no other reason for the difference to be felt as such. So that is very important
Yeah,
what you pointed out.
yeah. I mean, I think one reason, because this can also be like a red flag in relationships, is because as humans we keep growing, we keep learning, and there may be things that happen to us. We can't always be like happy, chirpy. It takes a lot of energy. Sometimes it's okay to just be just the mellow, boring person, and then just have that time together. And I think that is also so important with couples, like, so what should one think, like should they always be like happy, 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 doing something adventurous, like always having to have that high adrenaline rushing like activities, or is it okay to have that mellow time as well, like you know
Yeah. So I'll just give a very simple thing that anything in excess is harmful to your body and to your mental health. So, even if you're going through like the complete happiness patch for like a good around of 6 months, I can guarantee nobody can experience that happiness for that prolonged period. Because until and unless you do not have your ups and lows, do not have your roller coaster life, you do not enjoy the happiness as well. So you should always be open to things, and that if my life is not going straight, yeah, make an effort to make yourself happy always. That should be something what we all are thriving for today. Satisfaction, happiness, content in our life. But at the same time, you should be okay to sometimes just being by yourself, not doing something else. Even that could give us happiness. Like, not that every Saturday has to be a Saturday and it has to be happening. Well, it can be sometimes just you can sit around with your partner and just have a quiet dinner sometimes. Something like that. So it should be a mixture of both in which both the partners' wishes are always respected. That is something which is very important along with that.
Yeah, I think, yeah, I do definitely 100% agree with that. So I think, it's okay to keep still judging when you're like in a relationship with someone. What happens when you've already married that person? What happens in your marital life when, let's say, whatever situation, arranged marriage or whatever happened, like maybe it was a good patch of 2 3 years and people get married, and then maybe, let's say, one of the partners suffers from depression, anxiety, any other mental health issue, whatever it is, short term, long term. What happens then if your partner is not supportive? Like, what would be your suggestion to married couples then?
Absolutely. So see, as you said, marriage life is there something married life once it starts. It's always people call it as the bubbly phase, the honeymoon phase for the initial period. So that's where everything goes good, and you're ready to adjust to the level to another level for your opposite partner, just because you are into that happy hormone phase which is running around in your head. Right. So after that, when you're hit with something, so in such situations, again, as what I would say is that try to communicate with your partner. That is again very important with that time. And if the partner is not willing to understand or is just going into a blame game that you are not like this, you are not capable of doing XYZ chores, you are not fulfilling my needs, and whatever on those lines also, take up a stand for yourself, because if you are fine, then only that relationship will survive long term. If you are not fine, that will not stand up. So I'm not advising people that go and break off the relationship or like take up decisions at that time. In fact, when you are not mentally fit, if you feel you are not in the right place to take decisions, you should not. When you are emotional, highly emotional, you should not take any decisions. In fact, just approach for help, be it from your friends, family, or professionals, anywhere, but just ask for help. From because if your romantic partner is not giving you help, there will be always somebody else in your life who would be willing to give you help. Do not hesitate to go and just ask. Because once you ask, there'll be doors open to you and you will realize what has to be done and how the things has to be done. So always and always take a stand for yourself and take a break from that relationship if you want. When I mean take a break is that just reduce your communication and focus on yourself more at that time, irrespective whatever other consequences for you. Even if it is a married life what you are into for last 2 years or 20 years or 40 years, because I have clients who have seen to like 30 years marriage and then they are in question that why are we married? So I'm like, so that is the time where again it becomes that you have to rekindle the love, because relationship is something that you need to actively work upon. So in same way in this mental health, if something is hitting upon, to, that is the time or low phase where the opposite person has got to work, and you also have to work or take a stand for yourself if you're not feeling good in that part.
Great. So basically, that's a lesson for the both, parties in a relationship. Like, if you are the one, suffering from any kind of mental health issue, you should communicate and the other party should listen, and vice versa as well. Of course,
Absolutely.
obviously, it should always be on. It can't be said enough. But yeah, so basically, there's a a light at the end of the tunnel. Like, even if there are issues, like, definitely if both are willing, you're saying it can be worked out.
Absolutely.
Obviously, like, you help married couples and all. So, like, what are some other issues that you think married couples may face? Like, is mental health, like, are people able to look past that, or like, are partners supportive enough if their partner is like struggling with a long term mental health, let's say depression, because depression kind of changes you a lot, and if it's a long term depression, like, you may even not see life as you once did, and that's one of the reasons we choose our partners, like, our futures aligned. So what happens then? What is like, what do you think, like, that works out in the end?
Yeah. So see, the things in such scenarios where the someone is having something from a prolonged period, and if it is not addressed rightly, it would cause a lot of troubles. Even if it is addressed rightly, it could cause a lot of troubles. Like if some one of the partner is going through under some treatment, medicinal treatments, then that can impact their functioning at times, though the side effects are known, or else even their sex life, or the worst case is the burnout effect with the caregiver experiences. So at such times, whenever if any patient is under a treatment of a mental health professional, they would always make sure about the psychoeducation. What do I mean by that is that they will make sure that the other partner and the family member or whoever is responsible for that a person will also be constantly counseled and explain the prognosis and about the treatment line and also how the things should be taken ahead of and how to improve themselves and focus on their mental health also. Because, for example, as you said, depression, if something also long standing, or schizophrenia is moreover a very long standing illness, they can have a perfectly great life. If, for example, husband or a wife has schizophrenia, they can have a perfectly normal life with medications. But at the same time, the partner should also be taken care of. Treatment should be there. Mental health professionals, they should always visit over there. So the mental health professionals will also keep an eye and always keep guiding them towards it, how things can be made better in their life in that way. So that is very important during the long-standing care. The partner should not just feel that, okay, no, I will do it everything. Even you are human being, take a break and even you can go for help or just ask the person who's treating your partner at that times.
Yeah, exactly. Because I think there's, if you ask for it, the person suffering from that gets help at one point in time. But it's quite uncommon to see that people thinking about the caregivers, their
Absolutely.
primary like caregivers, which turns out to be the partners first,
Yeah,
and they have to just be there for that person because they chose that partner, for life, and then they must just keep committed, and then what about their mental health? It may also start to get affected. So thanks for pointing that out. I think that's also so important that breaks are a must, that you can
absolutely.
take a break for yourself and not like feel guilty about it, obviously, because
Exactly.
sometimes we know that as well. So I think one aspect, I think, and I think this can be our last topic we didn't, speak about, and you mentioned while responding to my question. How do you think sex life affects a person's mental health when they're in a relationship? If you could,
Yes,
shed some light on that.
absolutely. So sex life is something, another topic which people would not talk in India, especially at least, that the taboo is to another levels in that. But you need to understand that the mental health has a very strong impact on it, not just on the person suffering from it, but also the opposite person. So we'll take one case at a time. So for example, somebody is suffering from any mental health issue. So because of like something about the depression or anxiety spectrum, then those patients usually have low libido, that is decreased desire for sexual activities. Okay, so because of which their sex life will get impacted on a higher scale. At the same time, this will lead to a frustration for the opposite person if it is not conveyed. So, for example, if I am suffering from depression, I'm not taking a treatment and I've not informed my partner about it. So the opposite person will start doubting, okay, he is not attracted to me. Is there something wrong? That is a very common thing which goes around. Or they'll get frustrated out of that, and that's where it leads to extramaritals or any XYZ things which can lead to break up the marriage. So that is one very important impact. And another very important aspect is the medications. There are many medications available which have minimal sexual side effect, but there are sometimes which is required that we need to give those medicines because sex life is equally important. But if your mental health is not there, the sex life won't exist. So always communicate to your partners because there are certain medicines which can lead to premature ejaculation for men or erectile issues for the men. So which can be treated or managed. But you need to be open enough to explain to your therapist or to your mental health professional about it, and also to your partner instead of avoidant behavior. Like there are many men who will not be able to perform well, they would start avoiding the for the sexual activities, which will impact their relationship on a very high level. It is not about the frequency which what they are doing about just the sexual act. It is about the entire intimacy gets affected, and that will lead to the very major issues in the relationship, and that can lead to self doubts or anger, frustrations, or in fact, even the opposite person can go into another mental health issue altogether because of just not having a good sex life. So yes, mental health issues can impact your sex life very tremendously. So be aware about it and ask questions always about it.
Thanks for that insight. And I think what you just said, responded about this whole like aspect about like the sex life playing such an important part in one's mental health. It reminded me of that movie I saw recently, Magic Soup. I don't know, is that the movie's name? I forget. But yeah, I mean, I think that movie has tackled this question, hasn't it? I mean, maybe not too much about mental health as such, but that's what it is. I mean, psychologically, they make people think a certain thing, and then, they see results in that. So basically, a
Exactly.
placebo being provided to people who are ailing with this. So I
Absolutely.
think it's another taboo, like men's mental health, like that. It's just a whole thing, like getting men to speak up about something and having them taken seriously, because for so long society has just, said, oh, just be tough, don't cry, this, that. So that means like, oh, men can't have any problems, which is just ridiculous, and then
Exactly.
it's taking so much now to get them to speak up about things so that, both partners can have like a happy relationship. Because it's like always, like give and take. So, I mean, I think that's
Absolutely.
that's a very important point that you pointed out. So thanks so much for that insight. And I think with this, we covered this at a length, I think. And thanks to
Yeah.
you, Dr. Nichols. Thanks a
Most
lot for
welcome.
coming. But for now, I think if there are any questions, I'll just let the viewers, give them a couple minutes maybe to drop their questions, and then
Sure.
just check the comments if there are any questions for you. And I'll just read them out loud. And
For
in the
sure.
meantime, viewers, please feel free to just drop any questions you may have about, relationships and mental health. Because we have Dr. Nikunj here and he'll be happy to answer.
Absolutely.
All right. So I think I only see one question by one of the viewers. I think she's asked something. Okay, yeah. It's a two-parter, two-comment question. I'll just read it out and we'll make sense of it. As observed nowadays, that marriages are breaking due to boredom or extramarital relationships. What mental health issues are there if they keep changing partners frequently, though married? So I think that first part was statement, second part was a question. Yeah, do you want to take that up?
Yeah, sure. So what I am understanding from that question is basically they want to point out that if people are having multiple partners or extramarital affairs, what is their mental health exactly, or what is the issues they are facing from, is what I am
Mhm.
understanding from that question. So answering to that, what do I get is that uh, it varies person to person, first of all, because mental health today has a very wide spectrum which can give these symptoms or this as their outcomes. The most common thing is one of the what I spoke about is lack of communication. So if they are not having a good sex life, or they are not, if the opposite person is suffering from mental health, which is not addressed correctly today, can also lead them to go for the extramarital affairs. Along with that, there are certain mental illnesses in which the patients might behave in such a manner. So that is also very important. So that could also be the reason. So rest definitely varies patient to patient for me on this question, to be honest.
Yeah, definitely. And I think, if you are facing that, or your partner is, or anyone is facing that issue, I would really suggest to go to a professional and talk it out, because they'll
Absolutely.
be able to explain it better. This live is just informational. We don't know what's going on with you or your that person, or what their situation is. So we can't really comment on that. And from what we understood, I think that's a very fair response. So thanks, Dr. Nikunj.
Most welcome.
I think we just got another question.
Sure.
How do you deal with narcissistic partners playing victim when we have to address an issue?
Absolutely.
So, why cover this?
Absolutely, I would love to answer this question because I'm pretty sure there are many men, sorry, not being sexist, but yeah, in my experience, I've observed who are narcissistic to another level for many partners. So yeah, narcissism is something which is like in simple words, if I have to say, feed their ego. It is something which is very important to them. So if you have to ever address to them and who are playing as a victim, always communicate with by feeding their ego. So for example, let us take an example that you are not comfortable with their actions, which is leading you having trouble and which is causing stress for you as a partner. So always do not directly jump toward that you are causing the problem because of which I'm leading to XYZ. Instead, always have an approach that this is the problem I'm been having an issue. What do you think? So when you give an open-ended to your narcissistic partner who's playing victim, they will always have a guilt conscious, which is very much common in those patients. So when those things are addressed towards them and you put the question to them, though you know the answer, they would be able to communicate with you better and your problem would be addressed better. Always try to put towards them and then put up a statement for them. So always make sure
Yeah.
that you are asking them instead of directly clear complaining to them. Then they will communicate better with you.
Yes, definitely. I think that should work. May have some narcissists try that out on. But that being said, I think it's very important to understand that, do that only if you want to.
Absolutely.
Obviously, it's not something that anyone needs to put up with. And if you feel like that's something way out of your ballpark, then please, don't continue to do that. Because, I mean, be it marriage or relationship or premarital, whatever it is, like you always have the option to leave. I think that's
Absolutely.
what's on. And if the person's not willing to accept, or if someone's not willing to accept that they need help, or they're not coming asking for it, then they can't be helped, and nobody can really help them, because this is not like we can't go force them into treatment, or get a diagnosis of, oh, this is what you really are. I mean, if you're
Absolutely.
not in a comfortable situation, then please, get support of the right professional, obviously, and just let us know if you need help in our DMs. Yeah, or
Absolutely.
in any case as well. Like, definitely, lives are there to inform you, but professionals are the way to go. And
Absolutely.
Dr. Nicholas is one of them, and this is his, I think psychiatry page as well. So you guys can
Yeah.
just hit him up as well, and just get his professional opinion on whatever. So I think that's all the questions that we had for today and all the time that we had. I'm so glad for you, that you joined us, and, you gave us so much information about like relationships and mental health, because that can be so important to understand. And also thank you viewers for, staying and making this so interactive and asking questions. And please do keep dropping comments as well, even once this live has been posted. Don't need to, we don't need to close the dialogue anyway.
Absolutely.
But I think this has been a great session for me personally as well. Thanks again, Dr. Nikunj. Again,
I
see
would
you
like to
soon.
thank
Maybe.
CareMe Health and you, Shivani, especially to conduct such a session. To be honest, very few people talk about relationships and mental health today. It's all about themselves. So I'm very happy you chose this topic and we had a discussion, and I really enjoyed a session with you. Thank you for having
Thanks
me
a
over
lot.
here.
Thanks a lot. You're welcome.
Yeah,
All right. See you again sometime.
sure.
Bye bye,
Absolutely.
everyone.
Goodbye. Bye, everyone. Bye,
Bye.
Shivani. Bye.